Jain, good evening, everyone. I'm myself, Captain Akilaa. I am a part of this esteemed organization called Indian Army for the past 3 years. And firstly, I would like to thank the Indian Medical Association and Dr. Rishabh for giving me this opportunity. So before starting the lecture, I'm just saying that the PPT which I am showing is just for my reference, and it doesn't have the details. So it's more like a verbal session. So when I joined Army, I used to have the reference of many videos available in the YouTube or of advices from my senior for what Army is and everything. And once I joined Army, there were few main points which I wish I knew before joining Army. So I have included all those points, and this will be mainly a very frank session. It will not be a very formal one. So if any queries in between, please put up in the comment section, or like I'm not audible, please mention. So I've been part of this organization for the past 3 years. So let me get into it. Yeah. So to join the army, once I have to mention what you're going to join into. So when you join into the army, you as a medical officer, you will be a part of a very esteemed and very prestigious organization called Army Medical Corps. It has a very rich history. It has been part of it has been a big role in many Indo-China war or many major wars, and it's also a part of many UN missions in Gaza, Nigeria, and etc. So to join to the Indian Army, you can join in 3 stages. The first being you after completing the 12th standard and giving the NEET UG and going through the medical council and giving an interview in the AFMC and joining into the AFMC Armed Force Medical College, Pune, and doing your UG there and then continue your service. Or you can join as intern, which I have put a clause because it's a very rare situation. It has been only twice past 35 years that there has been medical officers or intern who has been taken into the army, recruited into the army as an intern. So as an intern, you will be doing, you will have 4 years of MBBS academic certificate, and then you will go into the army hospitals and you will do the internship. Then the most common way, to join as a medical officer through the interview. So the army will usually recruit a medical short service commissioned medical officers once a year or rarely twice a year. Uh, During the recruitment, usually in the November or December later parts of the year, the Indian organization will put up a notice in a common platform, public platform like their own website or in the newspaper like this cutout, where it will be mentioned that Armed Forces Medical Services are recruiting medical officers according to the vacancy they need. So there will be a recruitment. So first part of the recruitment will be you applying for the once you see this, you will apply an online application which will be put up to them, and they will be sending you a call letter for the interview. The interview usually takes place in the RNR Pune, Delhi, and during the interview, there will be a major 2 phases. First phase will be the main interview where they will be judging you according to your medical knowledge and how you handle stress. And the second part will be the medical fitness. So in the interview, it will, as I said, it will be happening in the RNR Delhi. So interview, there will be a panel of officers with one presiding officer who are majorly like specialists, medical specialists, surgical specialists, psychologists, psychiatrists. They will be there and they will be bombarding you questions of basic knowledge about the uh, medical situations, medical stuff like ECG, chest X-ray, and they might be giving you case scenario based questions where you will be put up questions like what will you do when mine blast happens, or like gunshot injuries happen, how will you control hemorrhage, what are your actions to it. There will be the psychiatrists and psychologists who will be assessing you how you are reacting to this say case scenario based questions, and how you are handling that stressful environment. And then they will you need to at least get a 50% of the mark in that. And once this interview is over, you will be your results will be informed, and you will be asked to get your physical medical fitness to be done the next day. So in the medical fitness, they will check your BMI, obviously height, weight, and then they will also check your chest expansion, whether your physique is you're physically fit enough to handle situations in field like situations. And they will also check your whether you're hemodynamically stable, like your blood report, your urine report, USG, your chest X-ray, your eyesight and hearing. So after all these, the organization will put up a list of candidates who are fit both in the interview and their medical fitness, and they will. The result is usually after 2 to 3 weeks of the interview. After the interview, so I forgot to mention this before the interview. Once you are called to the interview, that they will give you a form where they ask you to enroll. Mention what are your hobbies, what you like to do in army, what you are expecting in army, what kind of specialization you want to do in army, what kind of service you want to get into, whether army or navy or air force. So according to that, they will put your according to that, and according to your mark in the interview, they will put you according to it, and they will send a call letter to you after the results to your home, mostly post, or they will also mail you it, and they will give you a 1 month of joining period. In that posting order, there will be you will be posted to a specific military hospital, usually a hospital of your own state, where you will be having 3 months of training. So yeah, once you get your call letter, you will be reporting to the unit whichever you are posted in, and you will be commissioned. So commissioning is basically giving stars to your shoulder. So once you commission, you will be commissioned as short service commission, and in short service commission, you will be joining for a bond of 5 years to start with, and you can continue till a bond of 14 years. So it will be 5 plus 5 plus 4. You can leave in anywhere between after the bond completes, like 5 plus 5 plus 4. And in short service commission, once you commission, I would like to mention this also, you will be commissioned as captain in case if you have joined after the interview, the process and everything. But if you join as an intern in a military hospital, then you will be commissioned as lieutenant. You will be doing a internship for 1 year and then be turned to captain. You will be promoted to captain. So yeah, once your short service commission is started, after 2 years of service, you can give something called PC interview, that is permanent commissioning interview. So basically in PC interview, they will check what and all you have done for the 2 years, what good you have done for the organization, how well you have been active, and how what and all rescue operations or any specific things you have done. And there will be recommendations from your seniors. There will be credentials from your seniors who have who have given you points according to your medical skills and stuff. So after the PC interview, you may turn into a permanent commission. In short service commission, unfortunately, right now there is no PG available in this short service commission. Till last year, there was an opportunity of PG even in short service commission, regardless of your age and stuff. But last year there was an unfortunate ruling brought up, and there is no PG for right now for any short service commission. So once you finish your service, there is no pension available also. Coming to permanent commission, you can either be give your PC interview in the second year of your service and turn into a permanent commission, or you can be directly posted as permanent commission if you have done your UG in the AFMC, and 50% of the people who have scored the highest mark will be given the chances to take a permanent commission. But it's on you whether you want to take or not. And then once you have joined permanent commission, once you have become a permanent commission officer, you will be have to do it for 55 years of your service. And leaving in between is controversial, but you can do it. There are cases where they have left in between, but it depends on you. So once you join, once you complete a 4 years of service, you can give your PG NEET exam and get a good cutoff and get your PG seat selected. And there is again a clause in it since last year. There has been a ruling that PG will be only given to by the officers who are in the service of 4 to 7 years of service. And yes, pension is available for the permanent commission officers. There's something called ACR, which I want to mention, that is called annual confidential report. Basically, which I explained you before. In PC interviews, there is something called marking, where your seniors have given you, commanding officer has given you, according to your integrity, how medical skills, how your loyalty and stuff. So you will be graded according to that. Next, ranking system, I will briefly tell you about it. First, lieutenant to captain, it's 1 year of service. And then in captain, you have to do for 4 years of service. And major, 7 years of service you have to give to turn into a lieutenant colonel. And lieutenant to colonel depends on your effort on the army, what role you have done. It depends on the individual. So colonel, once you turn into 20 years of service, and depending on your specialty, you can turn into colonel as time scale colonel, or like selection colonel, and you can proceed to brigadier and major general. Any doubts will be clear later. So yeah, salary. Once you join, usually it is on captain rank, you will be commissioned as captain rank, and your basic pay level will be 10B. So in 10B, the basic pay for the first year will be 61,300, plus you will have the non-practice allowance, the dearance allowance, and other allowances like high altitude allowance, risk allowance, travel allowance. There are other allowances. So on and off, the take home will be 75 to 80K. Regarding depending on your income tax, your DSOP fund, there is something called AGIF insurance fund and everything. So there will be a take home of at least 75 to 80K. Next, coming to postings, once you're commissioned, you can be posted either in peace or in field. So if you're posted in peace, let's just, I will go in accordingly. Once you're commissioned, you will be posted, posted to a military hospital, mostly in a peace area, for the first 3 months of your service, where you'll be trained to what an army is, what are the responsibility, what is in disciplines to be followed, what and all, how to handle a new environment. You will be posted there, and from there you will probably be posted to a field area for 2 to 2.5 years. It can extend to 3 years sometimes. And before joining field area, there is something called medical military officer basic course. Is done by all officers. Basically, there will be 8 to 9 weeks of course done in OTC Lucknow. OTC is Officers Training College, where you will be trained to get the physical efficiencies and know what the role of organization is, how the military law works, what and all you can expect, what and all situations you have to handle, all the combat exercises. This will come to you at least within the 3 months or 1 year of your service. Usually, it can be late sometimes. And then coming back to this, so in field, you will be posted in field for 2 to 2.5 years, and mostly you cannot take your family there, because there will be challenges in regard to terrains, climate, and even counterinsurgencies. So it is not very safe place for the families to be. And it usually is a primary setup where you will be the only medical officer, and you will have you will be given a medical inspection room, MI room, with your there will be an assistant like nursing assistant and battlefield nursing assistants who will help you. And then in peace, you can accommodate your family along with you. And it usually is a tertiary setup where you will either work with a nurse specialist or super specialist, or you will be a group of medical officers working in a place with nearby MH, where a specialist help will be available. And one of the most disadvantageous part of peace is you have something called Adam works, where um, there is something in medical officer. Once you become a medical officer, you will not only be taking care of the health of the physical health of the troops. You will also have to take care of the mental health. You will also have to take care of the hygiene and sanitation of the unit. You will have to also have to give the awareness lectures and program. You have to educate them according to the places. Like in case of Rajasthan, you will have heat stroke, and you should make sure that they have take good amount of water. You should educate them what to do, what not to do. So all these are there. And I want to specifically mention something called UN missions, which is usually to the PC officers, but sometimes to the short service also. So UN missions are like special missions where you will be deputed you'll have a deputation posting to the UN, like Gaza or any places where peacekeeping missions will be carried out, and you will be helping along with other officers of other corps like engineering corps who have come to like build a bridge or anything. You will be there to give them a medical cover, medical support to the local people. Yeah, post graduation. So as I said, there is a clause now that 4 to 7 years of service of PC officer, only PC officers are available to do the post graduation. It depends on the NEETPG cutoff, and once you complete the post graduation, you may be posted to various field PC areas where your duties, where you are of duties. So you are helpful, and there you can do super specialization also. Once after your 15 years of service, you can apply for your super specialization, whether in army or even in civil services you can do. Next, yeah, as I specified before, a role of medical officer is not just for your medical cover. You will be having to do many more than that. You will have to maintain the mental fitness of the troops. Also, you have to maintain the hygiene and sanitation, and you will be having to train the NAs and BFNA who are going to be there as the first line medical help in warlike situations. So you will be having to train them how to control hemorrhage and how to act in the first situation of any trauma or any cases. Coming to leave, there will be a total of 80 days paid leave. There's a very, very common, wisdom word that leave is not a privilege. It's not a right, it's a privilege. So basically, it depends whether your commanding officer or the unit situation is preferable for you to go on leave or not. So the 20 days of casual leave is not encashable or not carried over. And the 60 days of annual leave in this part, that is 30 days of the annual leave, can be carried over, can be encashed when you finish your service. So let me just say what a day of an officer will be. Your day will start with a PT parade usually. So in peace areas, it will be starting at 6:30 and it will be for 6 to 6:32 and it will continue for 40 minutes. And then you will go have your refresh and have your breakfast, and then you will have a duty period of 8 to 6 hours, and then you will have evening again have a game parade where you actually have to interact with your troops and have a good rapport between them in case, so that they will follow your commands. And there are special parades like night parade and mandir parade. There are special parades which are just twice or thrice a week. So let me mention what a parade is. Parade is basically troops of all, regardless of rank, will be assembling to a point where they will carry out a single activity. So that's called a parade, not a physical parade. So ex-serviceman, yeah, I just want to put a small word in it. Once you complete a 5 years of service or whatever years of service you want to complete, and then you go out, you'll go out as an ex-serviceman. You'll have a privilege of 3 years where you can do your PG. It's ex-serviceman quota. There is the rank can be kept after your name, but with retired in the brackets, and there will be canteen facilities. So yeah, let me, before going to pros and cons, let me just say these are just my point of view, and just with my experience, I am saying there is no implication in pros or cons. Basically, pros, since it's a frank session, I'm saying it. Me from South India, for a medical officer, it is a good salary, and for my case, I didn't give serious thoughts about PG in internship, during internship. So right after internship, I had to earn somewhat in any way. So I wanted to go earn salary and prepare for the PG. So that's what I'm currently doing. You get a lot of respect. There will be at least 300 to 400 troops are under you, and they will be like following your commands. They will be saluting you. They will be asking you. They'll basically follow your commands in every way. And it is a very different experience, adventure. You will be seeing some gunshot injuries, mine blast, sometimes cold injuries, cases which are not very common in civil setup. You will be experiencing all these things. So it's a very different experience, and you will also get to shoot a fire. You will have experience with many combat situations, and you will have a good company. You will have many medical officers of your own age, of a similar age, where they will be experiencing similar things, and it is a good company, and there will be a ex-serviceman privilege. So coming to cons, let me just show you some pros of mine. I'm just showing it. So these are some places where I have been doing duties, and I feel very good about it. And there are very bad duties also where I had to be in tents, and there was no current or no electricity for days, no signal for days, for a month actually. So these are also there, and these are like good companies, and there will be sternest activities carried out and during your whole period of your service. So you will have to undergo many physical, you will actually challenge yourself in physical ways. So coming to cons, you will get into a very new organization. You'll definitely feel seclusion in the starting, and you will be secluded from your peers or your whole life, your family. So you will be secluded from your old self. And frankly saying, there is no career development in army for a short service commission now. Currently the rulings are not so great favorable for the short service commission. So there is not much of career development. There might be a personality development and personal development, but career development is currently questionable. And risk, yeah, there is definitely a risk for life, and there are risk for disabilities and everything, because you will be put into a physical sterness situations, and you will be asked to do running. You will be having a monthly exam running test, and you will be posted in high altitudes, and where you'll lack of oxygen, and you will go into a mountain sickness, or like you will have mental laziness, mental breakdowns. There was a friend who was posted in high altitude for 6 months, and once he reached down, he didn't even remember his house address and stuff. So there are situations like that. And uncertainty, you will be thrown to TDs, temporary duties, and thrown to duties with new experience, sudden duties. So planning is not correct in army. If you plan your year according to something, but it will not happen the same way, because there will be uncertain duties, and it is the exigencies of our army. So yeah, I would like to conclude that the only thing certain in army is uncertainty. So people who are like too plan based and too upright situations, only planned situations to happen, I would not recommend them to join army. Any doubts, please ask.
Okay, ma'am. Thank you for your speech. Here are some doubts we'll put in the chat box. I'll read out some of the questions, ma'am. So
Yeah.
here's the first question. Like one of our audience has that they are from the doing MBBS in Ukraine, it seems.
Ukraine, okay.
Okay, so once after finishing the course, only they have clearing the FMG exam, only they are eligible to join the Indian Army, or before the FMG clearance, so they can join.
Yeah, you need to do your internship in a recognized or a hospital or a medical college. Medical college. So Indian, you should be recognized. You should be doing in 1 year of internship in a recognized college, and you should have the certificate, and then only you can give your interview. So interview, you will have to give your 4 years certificate of your MBBS, along with it your internship certificate. And there's also a clause that you should not have more than 2 attempts in final year of your academics.
Okay, ma'am. The other question is that one of our candidates is asking that whether we have to call a senior officer sir or ma'am. Is it mandatory that we have to call?
Yeah, there is something called rank system which cannot be avoided. Yeah, there are things, but usually you will not be put into a situation where you will have to like follow things which are not officer like quality, or like you will not be put into situations where it's very bad situation. And if it is like that, you can actually put your point to a more senior officer, or put this point to the senior officer itself, and it will not it's not so bad here being an officer.
Okay, ma'am. Okay, thank you. The other question is that the short-term commission, it includes whether the 5 years or the 14 years, ma'am. Which is a short-term service commission?
Yeah. So once you join as short service commission, you are given the option to choose whether it's your 5 years or 14 years. So it can be 5 years or 10 years or 14 years. In any case, in 10 years, 10 years or 5 years, you will be going out as major. If you are choosing 14 years of service, you will be going out as Lieutenant Colonel.
Okay, thank you. The other question is that is it worthwhile to join army after the postgraduate in spite of questionable career development after post MBBS? Because this question is being raised in most of the candidate doing the post MBBS. That if
Yeah.
one of my friend is
Okay.
doing the PG general medicine immediately after my MBBS career, so he'll be finishing the PG in another 3 years. Whereas if I
Okay.
join the army, it will take 5 years plus 3 years, totally 8 years for me to take. Is it
Yes.
that way to take a break for a long time and to join a PG?
Yes. So let me just put it back. You are asking that is it better to join army after PG? Is it the question
Yes,
or
ma'am.
like yes, right? So after
Yes, ma'am.
PG, the thing is after PG you will be joined as first as medical officer only. You will not be joined as specialist. You will be a special medical officer, and you will be graded according to your specialization. You will be under a graded specialist, some associate who you will be working under them from 6 months to 1 year of service, and they will grade you accordingly. And then only they will give you a name called graded specialist, where you can put your degree in there. You can, but you will be posted in an hospital where you will be seeing your if you are an ENT specialist, you will be seeing ENT cases only, but you will not be a specialist there. You will be like an PG, last year of PG, you can say.
Okay, ma'am.
That's
So
it.
other question, ma'am. Sorry.
Yes.
Other question is that if I join this short service commission for the 5 years, it will be any benefits for my family as a person who's working in the army, like in whether my family will get any benefits.
Yeah, there are benefits. It depends on which part of the nation you are in. Also, mostly in South India, in like let's say Tamil Nadu, there is not much of privileges as ex-servicemen. But in other parts of the country, you have privileges. Once you join army, you will have you will be adding your family's peers, mostly your spouse or your child, as your dependents in the army. So they will be categorized as dependents of the ex-servicemen. So any medical emergencies or any things, they will be given the privilege of having the free medical services. And there are also like in many KV or like any colleges or they can be considered as dependents or like children of the ex-servicemen.
Okay, okay, ma'am. Okay. So one of our audience having doubt that whether he's very fit for joining an AFMC UG admission because his high site is now right now is minus 3.5. So whether he's eligible to join or not.
Yes. So I'm not particularly sure about this, but I think the eyesight for 3.5 is most likely to be unfit. The eyesight is a main criteria for the army because there will be trainings and firing trainings and everything which needs a proper eyesight. What I'm particularly sure is like 1.5 till 1.5 it is under the criteria. So more than that, I think they will judge you more according to your the extent of your vision, and they will check whether it is a myopic or what. They will check, and then maybe according to that they can decide. The specialist will decide.
Okay, ma'am. The other question, ma'am.
Yeah.
You have mentioned there is a field of focus with two types, peace and the field of work. So,
Yes.
HUF factory, we have so many HUF heavy vehicle factory which are comes on different services. So there are many medical officers who have been posted in the HUF factories. So in case of 5 years of a period of a service, whether I will be posted in HUF factory, the same place, like there is a Millington hospital is there in OT. So I will be posted
Yes.
other 5 years in the same place, or I will be rotating, and how the rotation pattern will be.
Yeah.
Any
Nice
idea is
question.
there?
It is a nice question. Yeah. Sorry that I didn't mention it earlier. So basically, as I said, you will be posted to one part of one military hospital on commissioning. It will be mostly for 3 months to 1 year of your service, where they will train you for the military stuff. How discipline you should be, how the army works, and or how the organization works. So once you after that, you will be mostly having that MOBC course, where you will be learning what to expect in field, and you will be posted a field. The field will usually be for 2 to 2.5 years in usual of the cases, but there are fields where you'll be posted for 3 years. There are always clauses and exclusions. So you after the field, there will be 2 course of peace, which is of 3 years. 3 years again, you will be posted back to field. So this is how it rotates.
Okay, ma'am. Other question, ma'am. This is one of the MBBS student. He's doing first year. So he's already a NCC candidate certificate holder, it seems.
Yeah.
And there's a question. If someone wants to join after MDMS, what rank they will be getting, and what kind of commission will be getting?
Can you please say the last part again?
So is that he's an NCC certificate holder in his school days.
Yeah. Yes.
If someone wants to join the MDMS, what rank they will be getting, and what type of commission will be getting?
MDMS as a specialization to join PG in AFMC.
Yes, ma'am.
Yes. To join PG in AFMC, you will be going through All India quota again. Your NEET cutoff will be there. You will be commissioned as major.
Okay, ma'am.
Sorry, I'm not very sure about this. I'll get back to you, Rishabh, and you please convey it to them. I am not very sure about it. It is a very nice question, but you will be commissioned as major from what I know. And you will be doing your service for 3 years, and you can decide whether you want to continue your service or you want to leave. Because since you are not joining as a short service commission as captain and then getting a PG in AFMC after on service, you are coming from outside, so you can leave on your own, from what I know. But the commissioning part is a doubtful part. Let me get back to you once I'm confirmed with my seniors.
Sure, ma'am. Is there any specific topic we have to concentrate for preparing for our interview? Like our interview date is next in 1 month. So we are in short duration of 1 month we have left in our hands. So what type of topic we have to concentrate for the preparation, ma'am? Any specific topics?
See, this from my experience, I'm giving you this. They will just judge you for the basic needs. Like if there is a pain abdomen, will you be able to manage the pain abdomen, and will you be able to manage it so that it will not be worse? It will not go worse into acute pancreatitis. It will not go worsen. So they will judge you in a basic way, whether you know to read a basic chest X-ray, whether you know to read a basic ECG, whether you can see MI or not. And they will also check your community medicine knowledge. The most of my questions were 2 to 3 were about community medicine, and they will also question about MRH. MRH control is a very main and common topic they have been asking in every interviews. Most of my friends who have given. So basically, how you control MRH, what kind of bandage you use, or what kind of splint you use. What do you know about how to tie the tourniquet? What time you have to leave the tourniquet, and what about the amputations? And sometimes they might ask you about the cold injuries, because those are the main things we see here. So they will, if you answer well in these things, they will go to some extent that about cold injuries and high altitude related injuries, which you will eventually learn here. But if you know that, then they will give you more points.
Okay, ma'am. Thank you. So
I do, Rishabh, sorry, I do have a list of questions which I prepared during my internship. For my interview. I will share it to you. You can put it up along with this, but I'm not. It's not an qualified questionnaire or something. It's just what I learned.
Okay, ma'am. Thank you. So joining the army, whether the knock-knee is a rejection criteria. So one of the candidates has this question. He has a knock-knee syndrome, it seems.
Yes. It is most likely to be unfit. It is because you will be expected to run, and there will be a situation where you have to climb mountains and stuff, and knock knee and any physical deformities like valgus, varum, everything, and athletic foot. These are all major factors for to be unfit.
Okay, ma'am. So is there any specific quota for the joining PG? Like if my parents were the ex-service man, so I'll be getting any privilege in joining the postgraduate, or is there any specific quota for these ex-servicemen children in colleges?
Yes.
Both medical and non-medical.
Yeah. There is privilege. There is definitely privilege. Given that your parents have created, mentioned you as their dependents, and they have done a official document when they were in service, or even in on service. So they will, you will have privileges mostly in many central institutes and many government institutes. So yeah, there is privileges. It depends on the state. Mainly, it depends on the state.
Okay, ma'am. So, is there any specific point for the dental doctors to be part of the thing other than the one of the doctors asking that? Any specific point for the dental doctors?
Dental. Okay.
Yes.
Yeah, dental also goes through the same interview and stuff. But the thing is, the amount of people taken in recruited in will be far less. In case of medical officers, they will take. If, for my case, there was 300 people selected. And only 30 of the females were taken. And in case of ADC, there will be 100 people selected, and only 14 to 15 people will be selected in females. So there will be very less amount of people commissioned, and they will also be commissioned as captain only. They will get, it is the salary structure is rank based, so they will be getting the same salary as what a captain is commissioned.
Okay, ma'am. Okay. So, other doubt is that if I'm joining the Indian Army and I'm in a short service for the 5 years, it's my second year of a service. I applying for the NEET examination, NEET PG. By the time I'm getting certified for NEET PG, so I have to complete all my 5 years to join the PG course, or I can take a break. So, 2 years have been done. I will go for NEET PG. After finishing 3 years of PG, can I come and resume the like the service? Is there any possibilities? Or 5 years is a 5 years bond, compulsory you have to complete it.
Okay, so let me divide this question. So once, as you said, 2 years, after 2 years giving NEET PG is actually not under the bond. You need to at least complete your 4 years of service to give your NEET PG. So in 2 years you're giving, so mostly you're not allowed to give. But if you're allowed to give and you got a seat, if you got a seat and you want to proceed the PG instead of service, you can do that. You can leave the service under some clauses where maybe you might need to pay a little for breaking the bond, which is not clearly said right till now. But there are cases where they have paid money and then they have selected PG, and you cannot come back and do the service once you have left army. There are very less chances, very or 0% chances, I can say, that they will take you back again if you have broken the bond and left. Because army is more about discipline and loyalty, and you have to follow the rules, so you can't.
Okay, ma'am. Is there any age limit, ma'am? Like as of now, for the short service commission, they have mentioned a specific age limit. So only this type of till this age they can participate or not.
So this is this year's sorry. This is this year's paper, the notice. So in this, they have specified that you should be, if you are a medical officer, you should be at least just before, at least not more than 30 years of age by the end of 31st December. And if you have done your PG degree, 35 years. So this has been a constant rule in army till now, but they can change it. They can change it. But as of now, this is the rule followed, that you should be at least less than 30 years of age by 31st of December of the same year you're giving the interview.
Okay, thank you. Is there any, just for audience, ma'am, is there any specific doubt to be asked to ma'am? Kindly put up in chat box.
Good evening, Dr. Rishabh. Good evening, ma'am. Excellent session we had. I mean, this is one of the session where we had a lot of queries from the participant side, which shows it's a very important topic and a lot of queries are there, and you have solved most of them. Thank you so much, ma'am. And to share a few words with us, we have our national chairman of IMA JDN and the state president of IMA Tamil Nadu, Dr. Akilaa sir, with us. So I request sir to please share a few words with us.
Thank you, Venkatesh, Rishabh, and all my dear friends. Good evening, all of you. Sorry, I missed the beginning of the meeting as I was traveling. So I heard that the meeting went on very well through Dr. Venkatesh. In fact, we are seriously involved in establishing this job portal, that is Junior Doctors Employment Exchange. And we are starting it on 14th of April in Chennai only. I think that is a great beginning for the junior doctors of our country. Let us hope that this will pave way for better career development for all the junior doctors. I solicit all your support for this big venture. And in the next meeting or the subsequent meetings, we will be explaining it in detail. Till then, goodbye to all of you. Have a nice day. Thank you very much. Over to you, Dr. Venkatesh.
Thank you, sir. Thank you so much, sir. And I think we have got few more questions in the chat box. Dr. Rishabh, kindly.
Okay, sure, sir.
I think Dr. Kalyani has asked, ma'am, any tips regarding the interview questions?
I did specify before, but yeah. So tips, what I haven't said before, they will be judging you mostly on how you're handling your stress levels. They'll be questioning you, bombarding you with questions, sudden case scenario based questions, and how quickly you react to it. And one of the main tips, if I have to give you, then if you don't know how to handle that specific scenario they just told you, then you have to outright say that you, sorry ma'am, I don't know it, so that they will know that if the situation actually is worse in a real time situation, you will actually ask for help to seniors where to get the help. So it is one big tip I got from a senior. The other tip is your attire, the way you dress up and go. I would prefer that it should be a little formal, and in case of men, to having a tie and tucked in shirt and proper formal shoes, pant. And in case of female, preferably a salwar suit with not any variant colors. A single monotone will be more preferable, and proper like collared stuff will be helpful. And other than that, in you don't have to be worried too much about the interview, because it will not be very strict or very difficult. It will be something which you have seen in the internship period, cases which you have dealt in the internship period. Those will be the basic questions you will be asked to you, and you will score more than 50 to 60% in most of the questions. And to get the proper service you want, you have to score a good rank in it, a good mark in it. And for that you need to know like a very depth knowledge about the medicine. But other than that, the interview will be fine, it will be easy. Can I read the question myself and answer?
Yes, ma'am, please.
Yes. Okay, thank you. So I just saw a question, like, will there be questions regarding anatomy and biochemistry? Yeah, there will be questions regarding anatomy and biochemistry, but it will not be like what are the end arteries, or what are not very specific stuff. It will be a very common questions, because there will be anatomy specialists and biochemistry specialists, there might be present there, and they will prefer to question you with their specialization. So they can ask you. I did get more than 3 questions in OG. Very basic questions like what is placenta previa, what is missed abortion, when, what month, what scan do you do. So very basic questions in internship, which you will see in internship. And they will not just finish with what is. They will ask what is the treatment you will give, what will you do. But yeah, they will ask very common questions they will ask. So, ma'am, if your aim is to doing specialization and super specialty continuously rather than taking any gap, is Army a platform? Currently, definitely no. The Army is not the right platform for super specialty, because if you are commissioned, you will be commissioned as short service, and the amount of people in short service turning into a permanent commissioned officer is very like 40% of what they are commissioned. So everyone will want to do the PG. So most of them will give the PC interview, but only 40% of them will go into the PC and only in that also you have to score the best rank to get your specialization of your interest. So currently I will not say if PG is your main role, then army is not the platform for the person. Good evening, I'm final year JMCU. I was considered a CUG. Okay, yeah, as mentioned before, eyesight of minus 3.5 is mostly unfit, mostly unfit. But to do a PG, you don't. I don't think it will be an entrance. But to join service as medical officer, it is definitely an entrance, and it's not a very good criteria to join army. Sorry for it. Is there any advantage if yeah, there is a big advantage if your father is an ex-serviceman, but the advantage will be like 0.2%. Same goes to NCC cadre. If you have a certificate of NCC cadre, then you will be, if you and the other person have the same mark, then you will be given a good, better opportunity to get the, you know, the service of your selection, the place of your selection. The seniority will be more towards you. Seniority is very important in army. So it is an it's a good factor, but it's not a big factor. It will not affect you. The more main important thing is your interview mark and your medical fitness. Okay. Is it a time bound promotion or vacancy based on promotion? No, it's not a vacancy based on promotion. It's a time bound promotion. As said before, you will be lieutenant to captain will be 1 year of service, and as a captain you have to do 4 years of service. Then you become a major. Once you become a major, you have to put off at least 7 years of service. That is, total years of service will be 11 to 12 years, where you will turn into a lieutenant colonel. And after lieutenant colonel, it's mostly based on how you perform in the army, what kind of what goodness army is getting out of you, and those things will decide, and whether you will be turned into a time scale colonel or a colonel of a good place. I am getting many questions about what interview questions will be on medicine, surgery, OG. OG, as I said before, surgery, they will ask you a very basic stuff like hemorrhage and stuff will come into how will you control bleeding, what kind of. For me, basically, they did ask me about OT ethics. What will how will you scrub and what and all. They gave me scenarios and what will you do. They asked me. And I do have a very important questions list. I currently couldn't find it, but I will definitely share it to Dr. Rishabh, and I'll hopefully it will reach you guys.
Ma'am, actually, just to add
Can
here,
you?
we have a WhatsApp group of all the participants. So we'll add you
Okay,
there,
nice.
ma'am. You can directly communicate with the participants.
Yes, thank you. Is there any questions coming to your eyes? What topics? Elaborate more on joining as intern. As I said before, till now in 35 years of this AFMC college, there has only been two situations where they had to recruit interns from outside situation. I have not been through the situation. I have only heard about it. So as what I heard was, it was due to the very demand situation for where they need interns, and there was very less graduates from the AFMC college, and it's mostly not going to happen soon, anytime soon, but there are chances. So can we get a ex-serviceman quota for PG admission after 5 years of service? Yes, you do get your quota as PG, quota as ex-serviceman in PG in all India for the 3 years after your service. After 3 years of service, you are not eligible for joining PG as ex-serviceman quota. You can join PG in AFMC again after 3 years also, but through your mark, not through the quota. Is there any advantage given to the children of ex-servicemen after joining army? I do have my colleagues who are second generation, third generation Faujis. I am not sure that there is much major role that your father or your whoever your parent is being an ex-serviceman, but there is a personal advantage in it because you already know how the army runs, and you will get gel well with them. You will know how to behave, and you will not have a first year or that seclusion period. So yeah, that is an advantage. Where did you learn about cold injuries, frostbite, gunshot injuries? Yeah, I am also from Tamil Nadu Medical College. It is not something learned in practical because we don't see any gunshot injuries or cold injuries. Basically, we do see something called heat stroke and heat exhaustion, but that also is very rare in here. But when compared to Tamil Nadu, there is more cases like this in Jhansi, in Rajasthan, where I was posted. There was so many heat stroke and heat exhaustion cases, and cold injuries also. You do get information about these in YouTube if you want to learn. There is something called acclimatization process. How many days you have to stay in one stage where you so that you will not get frostbite. There is something called hand parade where you have to like dip your hand in your little warm water so that your hand will not freeze and necrose. So these are there. These are theories. It's not mentioned in many books. It's mentioned in PGs like specialties books. But yeah, in surgery also you can see it in you do get the you know research papers. I mean the theory papers in the net. You do have it. What are all challenges faced as a lady doctor in army? Thanks for the question. I do want to specify this. There is not much like lady medical officer and male medical officer. You will be given treated same. You will have to run the same. You will have to only the minutes. They have to run 5 kilometers in 27 minutes. We have to run 5 kilometers in 31 minutes. There is a difference in that, but you will have to go through whatever they are going through. There is no exemptions in that. But unofficially, if you want to put, these are official things, but unofficially if you want to put, they might consider you not being posted in high altitude regions where there will be only snow, surrounded with snow, where you will not use there are situations where there's no washroom. You have to, the water will freeze. There will not be any basically if you are a lady officer, all the troops will be male, and they will have to have put you in separate tent, separate washroom and stuff. So to avoid that, they will not put you in those situations, so you will not have those exposures. But other than that, I will not give a very big disadvantage that being a lady officer is bad. And coming to personal part, yeah, being a lady officer is little difficult because eventually you are joining in the age of youth. Of your youth, your 24 to 29 years of service is given for me, and you will be needing to start a family and stuff. These things might be difficult. If you have a good partner and if they are supportive enough, then you can definitely lead it. Yeah, for low eyesight, is Lasik surgery permissible? Yes, it is permissible, given that the Lasik surgery is at least like done 1 year or before. After the Lasik surgery, you have at least gone through few months where your eyesight has been normalized and standardized. It is not going to change anytime soon. So if it is done like that, then you are fit enough. What are the challenges faced by civilian spouse? Yeah, there is definitely a seclusion from your family. There are things like you'll be away from family or most of the family situations and family functions. You will not get your leave when you need. It is not, as I said, the leave is not right. It's a privilege. So it's a privilege given by the commanding officer, given to you according to your situation. So there are things you cannot be in a year. You will be maximum 30 to 45 days with your family. The other days you will be away from your family. So these are the things you have to, face it. But yeah. Yes. I guess thank you has come.
Okay, thank
Any
you for
more
answering.
doubts?
Thank you so much, ma'am. Here we have Dr. Vijayvardhan
Yes.
sir, General Secretary,
Yes.
AIIMS Patna State Branch. Sir will be giving vote of thanks, ma'am. Thank you.
Thank you.
Am I audible?
Yes,
sir.
sir.
Audible,
Yes, sir.
Good evening, respectable audience. Our speaker, Dr. Captain P. Akilaa ma'am, Dr. Venkatesh Karthikeyan sir, and to all the participants in the webinar, good evening to one and all. On behalf of IIMS Tamil Nadu, I extend my heartfelt gratitude to each one of you for gracing us with your presence and active participation in today's enlightened webinar on job opportunities for doctors in defense. Dr. Captain P. Akilaa has not only shared valuable insights, but also has provided a comprehensive understanding of diverse avenues available for medical professionals in the defense sector. First of all, hats off, ma'am.
Thank you, sir. Thank you.
Okay. Our sincere thanks for accepting our invite for this in this Sunday evening, and also special thanks from Tamil Nadu, Dr. Abul Hasan sir, Dr. Karthik Prabhu sir, and Dr. Gauri Shankar. Also from IIMS Tamil Nadu team, Dr. Harihan sir and Dr. Trivengri Lakshman sir, and our convener, Dr. Venkatesh Karthikeyan sir. Special thanks once again. Thank you so much.
Thank you, sir. Thank you.
Over to you, Rishabh.
Okay, thank you so much, sir. Sir, shall we wind up the meeting? I think all the questions have been answered.
Yes, sir. Yes.
Okay, sir. Okay, thank you, ma'am. Thank you. Thank you, everyone, for joining the meeting. Thank you.
Yes. Yes, sir. Thank you.